A significant drop in testing at one of the St. Louis area's largest COVID testing labs. It was nearly 7 times higher 5 months ago. This comes as some concern has shifted to variants. News 4's Kim St. Ange is live in Brentwood tonight. And Kim, there's also been a big drop in the percentage of positive cases.
Yeah, this is good news, Sam. So every single one of these COVID tests that's taken at pretty much any SSM Health hospital or urgent care in the St. Louis area, including this one right here in the Brentwood area on Manchester, well, it's all sent to this one lab in St. Charles. And this lab is telling me it's seen a nearly 20% drop in the number of these samples that are being tested and coming back positive.
This lab, tucked in the basement at St. Joseph Hospital in St. Charles, is still busy testing samples for COVID every day.
We're testing fewer patients and we're seeing fewer positive patients.
Dr. Robin Chamberlain oversees this lab. We first introduced you to her in late November when her lab was receiving about 2,000 samples per day.
Now we're down to running around 300 samples a day here in our lab. And then in the other SSM hospital labs, we're running about 150 rapid tests in those labs closer to where the patients are located. So altogether around 400 to 450 tests a day.
Dr. Chamberlain says the positivity rate was around 25% in November. Now it's closer to 6%.
Where we are right now, I think there's just less COVID in the community than what we were seeing in November. So I think that explains why there's less testing and why we can keep up with it better now.
Some of the focus has shifted to variants.
There's evidence that new variants of COVID-19 are present in the county.
The UK variant was detected in St. Louis County wastewater last month. Chamberlain says any sample thought to contain a COVID variant is sent to the state lab because that testing requires specialized equipment.
What we're doing right now is watching for patients who have completed vaccination, so say are 2 weeks post-vaccination or more and then become positive. And those types of samples we forward to our state public health lab, and they'll manage those for variant testing.
How often are you seeing that come up?
So I would say right now we're seeing patients who meet the criteria to be sent to the state lab a few times a week.
All right, so I asked Dr. Chamberlain tonight if she expects to see an increase in samples sent to her lab because of these variants that we are seeing. She says at this point it's really hard to predict what will happen. The good news, Sam, she says, is as time has gone on, her lab will be much better prepared to handle it if that should happen.
All right, Kim St. Ange live for us in Brentwood tonight. Thank you.